Brown, Head of Children and Adults Transformation from Medway Council, and this is my colleague Bob Wilde, who's the ICT Change Manager at Medway. Before I start, I'm just going to let you know a little bit about Medway, because everyone hears of Medway and doesn't know where it is, because it's in slap bang in the middle of Kent. It's a unitary authority made up of 5 towns. You may know the name of some of them, so you've got Rochester, Chatham, Gillingham, Rainham, Stroud, Sittingbourne, Kent. We have one hospital, the Medway Foundation Trust, that serves Kent and Medway, and one CCG, who our commissioners work in partnership with, so joint commissioning between health and social care. Medway benefits from a stunning landscape setting. It has rich heritage, so we have Rochester Castle, Rochester Cathedral, Upner Castle, we have numerous festivals, universities and high-speed train links, so it's 35 minutes to London, so it's a really good place to work. But with any other area, there's challenges that need addressing, and there are marked inequalities in health, with life expectancies shorter for our residents. In 2017, our population was 277,616. This year, Medway Council is 20 years old, so in comparison to a lot of authorities, we are just a baby. Okay. So, a few things we're going to talk about. Why did we change before mobile working? Actually, quite interesting that we're doing this just after total mobile, because I can give some explanations about why we've done what we've done, what we've implemented after mobile working, and a roundup. And I'm sorry to say that we don't have anything like Milton Keynes cartoon. I feel quite sad about that. Okay.
The social care amounts to about half of the council's budget, so it's about 250 million a year. So being a unitary authority, we have to do everything. So we got social care, waste, highways, a lot. So a small percentage saving on 250 million is going to have a big impact on the council savings. Like everybody, we've got big budget cuts coming through. Within social care, the working practices haven't changed for 15 years, and Jackie will take you through the journey that we used to have to do, and it was quite horrendous. It was paper-based, over 400 social workers working on that, and so we had to do something to improve it. There was stress levels in the social care were very high. I'm having to cope with going out, doing visits, getting back and processing this vast amount of paper, and then getting ready for the next visit for the next week. And we needed to deliver results that were supportive to everybody. It was costly, it was slow, it wasn't an efficient way to work at all, working on paper. So fundings are being cut. We've seen year-on-year savings. We've got to save about 4 million, I think it is, on this year alone from the budget, and that's year-on-year savings. It's going to get worse. Everybody is now used to the digital age, and most people, and I think they did a survey in Medway, and we're up to people with access to the internet and using the internet is quite high. It's probably about 90%. But in terms of what we deliver on the internet, we're very low. We're almost the opposite of that, with the inverse of that. And with the social workers just using paper and going out and not being able to deliver services on the web or being able to deliver services efficiently, it was very long, very slow, and it wasn't good for what we had to deliver.
So I'm going to use adult social care as an example. We did look at places and looking at things like Total Mobile, and the reason we didn't use them was nothing to do with them, I have to say that, and it's not because James is here, but it was effectively we couldn't interface our system with them at that time, okay? And that was our technology that was the issue, not Total Mobile's. The cost for us was just too high. And quite interestingly, we use Serverlex, so we use Rio, and we're using Framework at the moment and moving to Mosaic. So James today is quite interesting because I can see perhaps that's the journey that we may go on, but we needed to do something now. So if I use adult social care as an example, as I just said, this is the way social workers worked. Phone call would come in, they'd have a conversation, they'd write paper notes. They'd input the information into the case management system after they came off the phone. If they were going out, they were prepared to go out to see the user. So they'd print blank assessment forms, write the demographics on the form, go out, do the visit, write all the forms up in paper, do basic notes. They'd make a to-do list while they were out there of all the things that they needed to do while they were with the client, and then they'd come back to the office. They would then try to input that information into the case management record. And when I say try, it's simply because they had so many other things to do, they weren't able to constantly keep up with things. So we were seeing performance dipping, and particularly, I have to say, in children's services, we were really struggling with our statutory requirements. So the to-do list I mentioned earlier on, they were trying to attempt to do that as well. So they needed to send a referral somewhere or do some signposting. Everything was just growing for them. And then they would be preparing to go out to do the next visit. So they'd done the assessment and then they needed to go out to do the care plan. So they print the care plan, do the demographics, and as you can see, there's a pattern occurring. It just goes on and on and on. Okay, exactly the same thing happens. They've done the care plan, they need to do the review visit. So you can see, it was laborious, and they were, I think stress wasn't the word, we really struggled with recruitment and retention of our social workers, both in children and adults. So we were tasked with doing something, and as I say, because we didn't have the capability to go down something like the total mobile route, we decided to look at another option.
So we looked at various options and we tried to tackle it in different ways. We looked at traditional laptops. If you're going out to visit you in the home, a traditional laptop, when you've got it open, actually automatically creates a physical barrier, as well as the problems of carrying the thing around. They're heavy. The battery life is low, probably about 4 hours if you're lucky, and the older the laptop gets, the slower it gets. If I've got to come out to your home and do something remotely, I've also got to ask you for your Wi-Fi password, which I'm quite naturally probably reluctant to give. And we wanted to access the network in a much better way. We tried creating some bespoke apps, and we wrote some ourselves. We tried looking at different suppliers. And I think the problems that gave us it was tackling one particular element of the job. So we looked at one which was financial assessments, a big complicated process. But by the time we'd written it, the process had moved on, the central government had changed the rules, and we were constantly on this catch-up, and we couldn't quite get there. In addition to which, it was just one process out of hundreds within that system. So that's the difficulties it gave us, was these physical barriers, lack of access to everything, and we weren't tackling the whole problem. We were just doing one little part of the process. So we took that and took a totally different view on things. So we had signed up to Office 365, and when we looked at Office 365, it wasn't just the front office applications that are available to people that we realised was actually open to us. For us in the IT world, it gave us access to a whole range of back office technology that we could use to connect things. So we did a trial. And we did a trial with these, which is the Microsoft Surface Pro. 12.5-inch screen. It's not really that heavy to carry around. It's a nice size screen to go. We also added in some extra bits in the background. So we created the technology so that with that, we gave them the version which is called the LTE, which means it's got a SIM card in it. I haven't got a clue what LTE stands for. I'll look it up one day. But it means they don't have to ask you for your password, for your Wi-Fi password. If they're in if they're in somewhere that they can get a 4G connection, they have got full connectivity to the network. So the big difference there is that not only can they get access onto they get access onto every back office application as if they're sitting at their desk physically connected to the network. They get all of their emails, they get all of their documents. So from going to saying we just build one application for one little process, they can now gain every single application as if they're physically sitting at their desks. So they're no longer filling in paper, they're going straight into the back office. The other bits we did, it's a touch screen. They've got electronic pen. So when they've completed the assessment work and they've done it in your home in front of you, they print out the assessment as a PDF, they give you the electronic pen, they ask you to read it, and you sign it whilst they're there in the home. So the time delays come down significantly. The other bit we wanted to get round was actually getting onto the device where they're sitting in front of you. If anybody's used a laptop from home or outside the office, it can be a bit of a torture. We still have BitLocker encryption because we want to protect the data, but that's the only one. Other than that, the other technology we've done is facial recognition. So if I now turn this to myself, it should log in, look at me, and I'm now fully into the thing. So that's how fast it is for somebody who's going to visit in your home. a massive difference. I haven't got to sit there and say, hang on, I've got to go through the BitLocker, then I've got to boot up the thing, sign in, then I've got to go through my RSA token or Microsoft authentication.
I will just add, it doesn't work in the morning. If I'm working from home and I haven't got my hair or my makeup done, it struggles to recognise me. When we were doing this, we did test it with a photograph. We printed out a photograph the same size as the place, held it up, it would not accept it. We tried it with twins. It differentiates between twins. It is a 3D mapping. So that's how we made it easier for them. So we made it so much easier for the guys to get in and work. Okay, so going back to our original phone call with the service user comes on. We've also implemented Jabber on this, so you've got the headphones on, so as you're talking to the client, you're inputting straight into the system. You're preparing for the visit to the service user, you haven't got to print anything. You go straight into your system, you can go straight into the record, so that when you're out, you're inputting while you're out there. Some people are saying that they absolutely completely complete the assessment while they're out, or the care plan while they're out. Others will take brief notes. That's their independent and personal choice. Some people will do everything in the visit and others don't want to do that, and actually they're quite happy, and it's their choice. If they want to sit in a car, go to the library, etc., they can complete them there. Same with the care plan, you can just see basically how much shorter it will do. Okay, so we gained feedback from the service users. If we going back a step, one of the biggest problems that we've had is the cultural change, not necessarily from the workers, but from the managers. There have been some managers who are absolutely adamant that their staff will not go out and use mobile technology, or actually they have to be in the office. So we've had people who want to go out but haven't been able to, and we've had to do a lot of work with those. So from a feedback point of view, we wanted to get that feedback to say to them, this is what your social workers and frontline staff are saying. So you can see there, it saved invaluable time by enabling us to access case notes. Conflict, I found that one quite a strange one, but what the practitioner said is that she often got into debates and arguments about whether she had or hadn't done something with members of her team or with other partners, and actually because she had it documented there and then, she could go, actually look, there it is, and then the argument stopped. The Surface Pro's added a truer sense of mobile working, so this piece of equipment is with me, my office is where I am. This guy, and he doesn't mind me saying it, he's a young single dad, and he was really struggling about how he could do his childcare and everything, and we are actually a really flexible organisation, so it enabled him to get up in the morning, do what he needed to do on this while his son was getting ready, take his son to school, do all his work, pick him up, take him back home, and he's saying that he's, from his point of view, it's made a massive change to his life. Stress levels have gone down. There is still stress. That's not going to go away. I think that's just part of social care, but the levels are reducing. From a service user experience, some of the feedback we've had is about a service user with visual impairment being able to sign his assessment. Because you download it as a PDF, you can then stretch the PDF document, give him the pen, and he was able to read the information and sign his assessment, and he said that's the first time he's been able to do that for a long time. The 97-year-old was just beside himself because he could actually sign the assessment. It wasn't because he had any impairment, but actually just physically using it, he was absolutely beside himself with that. And information and advice and guidance has been given to people. So effectively in a meeting, if they want, in a visit, if they want to know something, they just ping people an email there and then that is the story. Okay.